Hi, this is Dr. Mercola, and I want to talk to you about a very common problem. So common, in fact, that 1 out of 3 of you watching this has it. And that clinical condition is called hypertension. Now that sounds like you might be tense. Before I started med school, that's what I was confused, and I believe many people have that confusion. But hypertension is actually, of course, high blood pressure. And although tension or anxiety can contribute to high blood pressure, certainly, it is for the most part not the primary reason why people have high blood pressure. So let me give you some of the definitions first. Typically, you're diagnosed as having high blood pressure if your blood pressure reading is above 120/80. And the first number is what's called the systolic. And that typically should be below 120. And the bottom number is called the diastolic, and that typically should be below 80. So if you're in below those ranges, there's not much of a concern. However, if you have been diagnosed with high blood pressure, it's important to understand that one of the most common risk factors for high blood pressure is weight. So if you're obese, that is going to increase your risk. But interestingly, the way we diagnose hypertension is by taking your blood pressure, and that's typically done by putting a cuff around your arm. So it's important to understand that there's different cuffs, that if you are large, or especially very large, you're going to require a larger cuff. So when you get the blood pressure taken with the cuff, it's very important you look at the blood pressure cuff and make sure, they typically have marks to make sure that when you wrap the cuff around that it's within that normal range. And if it's not, then you need to find the right size cuff. Now this actually goes the other way too, so that if you are a very tiny or a small child, and you need to use a pediatric cuff. So that's an important consideration. Now, it's also important to understand that there are typically medications are used to control this. And the traditional approach, that is the major strategy. And hypertension is really almost a dream come true for drug companies, just similar to cholesterol, in that it is a drug that typically doesn't have signs or symptoms, but that they have developed a number of treatments for that don't change or modify or at all address the cause of the disease. And in fact, to this day I remember reading my medical physiology textbook that when we were studying hypertension, and it was called Guyton, the Guyton textbook of physiology, and it listed that the 95% of the cause of hypertension was what they call idiopathic, means they don't know. But that's just not true. We know what the cause of hypertension is. For the most part, it's related to your body making too much insulin. Very similar to cholesterol. So when your body makes too much insulin, it causes your blood pressure to increase. So there are fortunately very simple ways to lower your insulin levels. And you know, folks, you can measure this. All you have to do is have your blood tested by your doctor, a fasting insulin level, and your insulin level you want to strive for is about 2 or 3. If it's 5 or certainly over 10, you have got a problem and you need to lower that. And of course you don't lower it with drugs, you lower it with natural approaches. And one of the most effective ways to do that is with exercise. A regular effective exercise program, which consists of certainly aerobics, anaerobics like sprint, burst types of exercising, strength training, and ideally you'd like to have someone monitor and supervise your program, because it's really vital that you get this right. But a good comprehensive holistic exercise program will go a long way towards reducing that. And ideally you want to, if you're to do that, you're going to need to get to about an hour a day, somewhere in that range, but you want to work slowly and start slowly. So that is one of the most important. The other is to cut out foods that's going to raise your insulin. And typically foods that would do that are sugar types of foods or grains, because they break down to sugars very rapidly. Even whole grains, organic whole grains, will do that. So if you have high blood pressure, hypertension, high cholesterol, or obesity, you want to lower those. So that would be breads, pastas, rice, cereal, potatoes. Even if they're organic, it's still going to do the same thing. Until you get those under control, you want to stay away from those. And fruits are also fall in those categories because those are high in carbohydrates. So the other thing you can do is make sure that you're reducing the stress, because that is a factor for some people, and prayer or meditation or EFT, emotional freedom technique, is another useful thing. Now, another interesting new insight that is very clearly powerful and effective is to normalize your vitamin D levels. And I've got lots of information on vitamin D, and you've probably seen or read some of that, but if you haven't, then clearly examine that, because vitamin D is unquestionably associated with a lower vitamin D levels associated with an increased risk for heart disease. And vitamin D, we know now, actually lowers and normalizes your blood pressure, so that's a good strategy. The other thing you want to do is to make sure that you're having your omega-6 to omega-3 fat ratio is correct. And most people have that ratio is about 25 to 1 because we've radically increased the amount of omega-6 fats. So you want to make sure you lower the amount of vegetable oils in your diet and make sure you have a high-quality source of omega-3 fatty acids. That's going to be really crucial. Now, I also want to give you a warning. Now, you know I'm opposed to taking medications and drugs. And clearly, the long-term strategy is to get off of all your medications. But if you're on a medication, you certainly want to do that with a supervised healthcare professional. And if you have very high blood pressure, I hardly ever recommend the use of medications, but it is vital that you go on a medication to lower your blood pressure if it's very high, because stroke is real. People die from strokes every day. And if your blood pressure is too high, you are at risk for developing a stroke. And I don't know if you've ever seen anyone with a stroke, but it is not pretty to lose your brain cells. It tends to be permanent and irreversible, so you want to make sure that you're not increasing your risk for that. So make sure you're using a safe medication by a physician who's going to monitor you with those until you're able to implement these lifestyle changes that will allow you to slowly wean off the medications and get the cause of the problem addressed. So hopefully this will provide you with some practical insights of some strategies that you or your family members can use to take care of this very common condition.